So I'm Lorraine Gerard, and I'm the Executive Director of BC Hospice Palliative Care Association. And I want to take this opportunity to thank Gloria and the Gerontology Research Center and Simon Fraser University for inviting BC Hospice Palliative Care Association to be part of this conference. Gloria shared with me that she always tries to have something be very practical during the Friesen conferences, and I think she's done a great job. So I'd just like to acknowledge BC Hospice Palliative Care Association. Its members are individuals and hospice societies that work around the province. And the lady that just spoke at the microphone, thank you very much for your kind thoughts, and we'll pass it along to all our members. BC Hospice Palliative Care Association advocates for quality, responsive care for all British Columbians when they are dying or grieving. 32,000 British Columbians die every year, affecting 5 people each person who dies. So 160,000 people every year are affected by the deaths. They're being grieving, unable to go back to work right away, and so the grief and bereavement programs that the hospice societies deliver are just amazing and are so needed. So with all of those numbers, though, there's a couple of other numbers that you need to know. Between 16 and 30% of people in British Columbia who die have access to quality hospice palliative care. So we have a lot of work to do. Yesterday, for those of you who were here, you heard Doris Barwick speaking. And Doris is the Executive Director of the BC Centre for Palliative Care. That centre is something that's unique in Canada, maybe actually unique in the world. And we've been working very closely with them since they were established in 2013. One of the things that she didn't get a chance to talk about yesterday was the new seed grant program that we have established with the BC Centre, so that all of our hospice societies can apply for seed grant funding for 2 amazing initiatives. One to do with advanced care planning, and you've heard a lot about advanced care planning in the last day and a half. But what this focus is on, what we call community workshops, volunteer facilitated advanced care planning. We're targeting younger, healthier people so that you have these first conversations about advanced care planning before someone in your family has a scary diagnosis, when you can think about it objectively, having that first conversation about the big things, what you would like to have in terms of care, what you wouldn't like to have, what things are important to you and what things are not important. And later on, if someone in the family does come up with a scary diagnosis, you've already approached that conversation. It's going to be much, much easier. The other important thing to know is that the 30 or the 52 or 50, I think it's 56 page long, My Voice is now gone. In fact, I asked them not to print anymore. There's going to be a new one. It's much, much, much shorter, much more inviting and much easier to complete, and really is a guide. There will be other new tools that the center and the various committees have been working on developing. And when I first started in hospice palliative care and I saw the My Voice document, fortunately I knew the person who had written the original one, which was 12 pages long. It then took a little trip through the ministry's legal department and communications department, and 56 pages long. And so you shouldn't see any more of those. One of the things that we know very, very clearly is that in order for any of the advanced care planning work that the community will do, that you will all do, anything that we want to do in terms of increasing access to quality responsive care when people are dying and grieving, has to start with normalizing the conversations about dying and death and planning for care. Kelly yesterday told us if you talk about it doesn't make it so. Just because you talk about death does not mean you will die immediately. You will die. We will all die. We're one of the 32,000 that will die in any one year. One of the things that I believe is sort of an unintended consequence is the discussion around Bill C-14, now called Medical Assistance in Dying, has brought the whole subject of dying and death to the forefront. There is usually not a newspaper any day that doesn't have an article to do with the new bill. Regardless what you feel about the Supreme Court decision that has started this conversation for Bill C-14, it's a serious issue. It deserves a lot of conversation, and it will be I don't know how to say that word, divisive. Divisive? Yes. English is not my first language, I'm sorry. The people who work in hospice palliative care are, for the most part, very conflicted, wanting to ensure that people have their rights respected, but having difficulty when their whole working life has been around providing the best quality care without hastening or prolonging death. So it's going to be a very difficult situation for a lot of people. And I guess our position right now is that we believe it would be very sad if someone chose physician-assisted suicide or medical assistance in dying simply because they couldn't get access to quality hospice palliative care. So now comes the shameless plug. If you're not too tired of conferences and would love to attend another, BC Hospice Palliative Care Association is hosting its annual conference on May 27th and 28th, which is a week, Friday and Saturday, in Richmond. We're going to be focusing on plans, advanced care planning, partnerships, developing compassionate communities around individuals who are living with chronic illness and life-threatening conditions, promotions, that whole area of how do we dispel the myths about hospice palliative care and how do we tell people what it's all about, and practicalities, which is practical information for hospice societies. If you want any information about it, it's on our website, bchpca.org. Thank you.
I want to join Lorraine and Gloria and all of you in remarking on how much we've learned these past 2 days. It seems like it's been a week, but it has been only a day and a half. For those of you who don't know me, my name is Roz Kaplan, and I am the proud program director of the Liberal Arts and 55 Plus program. Proud to be part of SFU and proud to have an organization whose primary focus is learning and education. So in that vein, I want to bring your attention to a couple of events that we're having. One is in cooperation and partnership with Gloria and her group with Health Canada, and it's a public event on household chemical hazards workshop. So it will help us identify all the different elements that we work with and live with and how to avoid it and make ourselves safer. To register, you get in touch with Gloria's office, and there are flyers on the table towards the back of the room. And I also want to say that advanced planning and thinking about our end of life is something that our program will continue the conversation on, and we will look to partnership with a variety of organizations to bring workshops to our students on advanced care planning, representational agreement, and just understanding how to have those conversations with their family. And I made the mistake of printing that 26-page copy. It's still sitting on my desk. I haven't dealt with it because it's 26 pages. I will throw it away and wait anxiously for the shorter version. I talk about it all the time, not just with my family, but as a professional, and I haven't done an advanced care plan. I know, look at me like that. I agree. So my pledge is that when we do this program, and you're all invited to come when we have it. Information will be posted and emailed to those of you who are on our email list. I will be the first one to do it. That's my pledge. And in order to get more information for anybody that wants it on the SFU's Liberal Arts and 55 Plus program, just go to our website. We have brochures on the table outside and request to be added to our mail list. Thank you so much for coming, and thank you to all our presenters for really a wonderful program.
just before we leave, I want to say a special thank you to Heather Cowie, who is behind the screen here, who helped to make sure that our AV went smoothly. I want to thank Marissa McDonald for putting together that last panel. Laura Bowie for working with me on the panel yesterday on dementia. I want to thank Marissa and Shelley Davison, who came into the office last week and helped us to print badges and stuff bags and do some of the scut work. And to thank also Melinda Aiken, who is the receptionist for the Gerontology Research Center and who was the person who registered you when you came in. The other people I want to thank are our two gold sponsors, CMHC and the Bria Century Group, and also our coffee break sponsor, BC Housing, and our exhibitors. And the two exhibitors that are up here in the corner that didn't have quite as much visibility as the ones at the back, I do want to draw your attention there in the program to the Justice Institute, which has a very interesting advanced specialty certificate for community care licensing officers, and the Queen's Park Healthcare Foundation that's been raising money for many years, for 30 years, for Queen's Park. So I hope that on your way out the door you might go past and just pick up their booths or their materials, or you can get their websites are in the program. So we really do appreciate those who exhibit and sponsor and help us to keep the prices down so that the Friesen conference, very deliberately, we keep to make it affordable. We don't want anybody to want to come and not be able to come because of the cost. Thank you.